The Senate Health, Education, Labor, and Pensions Committee will please come to order. Today we are holding a hearing on our nation's growing mental health and substance use disorder crisis. I will have an opening statement, followed by Senator Murkowski. She's standing in for Ranking Member Burr for this hearing. And then we will introduce our witnesses. I believe Ranking Member will join us a little later as well. After the witnesses give their testimony, senators will each have 5 minutes for a round of questions. While we were unable to have the hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov. And if you are in need of accommodations, including closed captioning, you can reach out to the committee or the Office of Congressional Accessibility Services. We continue to see a high number of new COVID cases, so we are having this hearing in a larger hearing room where we can be socially distanced, limiting the number of people who are in the hearing room, accommodating both some of our committee members and our witnesses through video, as we have done previously, and taking additional measures such as wearing masks. As always, I appreciate the work from the staff of the Sergeant at Arms, the Architect of the Capitol, and our committee clerk and staff to make this hearing as safe as possible. Thank you to all of you. Even before the COVID-19 pandemic, our nation was facing mental health and substance use disorder challenges on multiple fronts. Millions of people experienced depression, anxiety, and other mental health disorders. Drug overdoses were on the rise, and our health workforce was stretched far too thin. In 2018, mental health issues were responsible for 56 million doctor office visits and 5 million emergency room visits. In 2019, suicide was the second leading cause of death among adolescents. From 1999 to 2019, the rate of overdose deaths more than tripled. And then COVID-19 hit and made things worse. Our nation lost over 100,000 people to drug overdoses in a single year. And overdose deaths, especially deaths involving fentanyl, skyrocketed in my home state during this pandemic. Nationwide, we're also seeing a concerning rise in methamphetamine and cocaine use as well. Across the country, people are stressed, and this pandemic has been especially traumatic for children. Our schools, teachers, and education leaders are seeing this every day. Our educators are on the front lines trying to help so many students experiencing mental health challenges, often without the support of trained mental health professionals. We've seen sharp increases in kids' visits to the emergency room for mental health crises, thoughts of suicide, and suicide attempts, especially among girls. And as of last December, over 167,000 children have had their world shattered after losing a parent or caregiver to COVID-19. Some have even lost both parents. And we know marginalized students are facing the worst of these challenges, deepening inequities they already face. We also know educators and caregivers are facing their own mental health challenges from the strain of this pandemic as well. We need to continue helping our students and educators and ensuring schools have the support, training, and resources they need. But right now, our mental health and substance use disorder workforce is stretched too thin to meet the needs of our kids, let alone our communities at large. And if we just keep stretching without taking action, something is going to break. For example, nearly half of psychologists reported feeling burnt out last year, and we aren't even close to providing mental health care to everyone who needs it. Almost 130 million Americans live in areas with less than one mental health care provider per 1,000 people. In my home state of Washington, our mental health care workforce is only able to meet 17% of our state's needs. Meanwhile, nationwide, less than 1 in 10 people who need treatment for substance use disorder actually get it. And these hardships are not felt equally. The highest increase in opioid deaths recently has been among Black Americans. Rates of suicide are highest among American Indian and Alaska Native populations. And people with developmental disabilities who were already almost 5 times more likely to have mental health needs have had their lives upended. Of course, while some communities may face greater behavioral health challenges, this crisis affects all of us. Even if we aren't personally struggling with mental health or substance use, we all have friends and families who are, whether we realize it or not. We all rely on first responders, healthcare providers, teachers, and other frontline professionals who are facing burnout and trauma. We all have a stake in making sure people can get the help they need. That's why Democrats passed the American Rescue Plan to provide resources for schools to hire counselors and psychologists, community-based behavioral health providers, programs to treat mental health, suicide, burnout, and substance use, and more. But we are not done. Healing the scars of this pandemic won't be quick or easy. This will take years, and we must act accordingly. It's time to build on this committee's bipartisan history of expanding access to mental health services and responding to rising drug overdose deaths like we did in 2016 and 2018. In my state, I have seen how communities can benefit from some of the critical programs this committee has worked on, including programs at the Substance Abuse and Mental Health Services Administration. For example, in Clark County, which saw fentanyl deaths triple in 2020, Lifeline Connections is using a SAMHSA grant to better prepare teachers and school personnel, law enforcement, first responders, and caregivers to respond to mental health crises and refer those in need to appropriate treatment. Meanwhile, in King County, federal support has allowed Neighborhood House to provide mental health services for over 150 adults experiencing homelessness. And the Confederated Tribes and Bands of the Yakama Nation are using grant funding from SAMHSA to fight the high rate of suicide in their community by updating their health records and mental health procedures, hiring more therapists, and expanding telehealth services, which have been critical to reach people during this pandemic. If we are going to respond to the behavioral health issues this pandemic has made worse, it is clear we have to build on these efforts. That will take legislative action. So I look forward to hearing from our witnesses about how we can do that and working with Senator Burr and everyone on this committee on a bipartisan effort to reauthorize, improve, and expand critical federal programs that address mental health and substance use disorder challenges. I hope that every member of this committee and the Senate can work together to bring their priorities forward to us to include. My goal is to work with Ranking Member Burr to fold these priorities together into a larger package that makes progress on many of the issues that we are going to hear about today, like suicide screening and prevention, youth mental health, the opioids and overdose crisis, and breaking down barriers in access to mental health. Finally, I want to acknowledge that mental health and substance use disorders do not exist in a vacuum. In addition to this pandemic, there are a lot of issues people are worried about right now, from gun violence to climate change to systemic racism to just making ends meet. As we work to do more to help people struggling with depression, anxiety, and stress, we also need to look for ways to solve the problems that are making things so hard for so many people in the first place. And I hope to continue to work with my colleagues on these root causes as well. I'd also like to introduce two letters for the record, one from the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association with recommendations for addressing the national emergency in child and adolescent mental health, and the other from members of the American Federation of State, County, and Municipal Employees, highlighting the importance of supporting the behavioral health workforce. So ordered. And with that, I will turn it over to Senator Murkowski for her opening remarks.